які присутні офлайн, у нас є і запрошені наші колеги і гості, які знаходяться офлайн. У нас можуть питання бути як із залу, ви піднімаєте руку і задаєте питання. Так само ми будемо приймати питання, які задають наші колеги офлайн. Ще хочу зазначити, що сьогодні з нами присутні наші партнери з USAID, буде трошки невеличкі, скажімо так, практика англійської мови, але ви отримали всі, я думаю, ті, хто мав таку можливість або хотів, буде переклад, синхронний переклад. Ну, начебто тоді все. І розпочнемо наш захід. Я до вітального слова запрошую міністра охорони здоров'я України Віктора Кириловича, будь ласка.
Добрий день всім, бажаю міцного здоров'я. Колись я у 2018 році прийшов заступником в Центр громадського здоров'я, тодішній керівник Володя Курпліта сказав одну фразу, яка зараз крокує зі мною по життю. Він сказав, мене не цікавить процес, мене цікавить результат. І де-факто зараз все, що ми робимо так, щоб досягати результату, не зациклюючись на процесі. І коли ми сьогодні говоримо про Prozorro Market, це реально, напевне, один із найдовших процесів, який був зі мною, бо я розпочинала про нього говорити, коли я ще був заступником міністра, а потім міністром. І сьогодні ми можемо з певненістю казати, що вже є результат. І цей результат вже багато хто відчуває. І коли ми повертаємося до наших трьох ключових речей, які ми робимо у сфері охорони здоров'я, ми кажемо, що вони всі базуються на трьох базах: доступність, якість і безоплатність медичної допомоги.
Prozorro Market ensures the first two, accessibility and being free of charge. We can see that it's a really transparent tool which helps us procure medicines which can later be used by patients so that they can get the medical help that they need. So I would like to thank the team of the State Enterprise Medical Procurement of Ukraine. They are the pioneers. I understand how difficult it is. So they've already had their first cup of coffees and had the first discussion with the Ministry of Economy, but we also have the law enforcement, we have other ministries and agencies, we have other stakeholders. It's really difficult to stay calm and try and just reach the result, but the team is very efficient. They show the results, so I'd like to express my gratitude to the team. I know that members of the team may change, but we have the results still. And I'd like to express gratitude to our international partners who always support us, knowing how difficult it is to implement all the innovations, but we still strive and we still achieve the result. And as the Deputy Minister of Economy said that medical procurement of Ukraine is probably one of the best procurement agencies in Ukraine, and it's a good compliment because the state enterprise is working so that people are not sick, so that people are healthy. Thank you, and I wish for us to have a productive forum. I would now like to give the floor to Deputy Minister of Economy Nadia Bihun. Good morning, everyone. I'm happy to see all of you. I say that those involved in procurement are not a big team. There are not so many of us, and we know each other, and it's really happy to see familiar faces and to discuss the challenges that we are facing. Indeed, Prozorro Market has been in development for quite some time, and as the Deputy Director of Medical Procurement, I believed in the tool back then, and I started with its implementation when the State Enterprise Medical Procurement of Ukraine was just being created. I said it out loud that my objective was to create a market for medical procurement because it's really difficult to teach 3,000 hospitals to procure efficiently. course, it's a great victory for our colleagues who are still involved in centralized procurement, trying to make it more efficient, showing that Ukraine and Ukrainian institutions are capable of such procurements. We are an example for neighboring countries and not just neighboring countries as far as medical procurement is concerned. And our experience is one that we can boast of and one that can be scaled up. But of course, other than the centralized procurement, we have local procurements taking place, and it's necessary to have an instrument that would make those local procurements more efficient. And that's where the state enterprise medical procurement is really efficient. And I really hope that I just remember when Prozorro started out, we were saying that we were sucked. We were Prozorro sucked. And the virus that we were spreading, our approaches were being spread across other agencies for everybody else to follow our suit in other agencies. So they practically contracted this virus from us. So I would like to believe that what medical procurement is doing, they are also sacked in a way. I'm just kidding here. So they are trying to disseminate their expertise across other agencies and bodies. And there should be a number of new agencies that would need to contract this virus. We already have the transmitters, so there are people who have experience with centralized procurement with Prozorro Market, so we need to do the scaling up of the processes so that all the managers know how to do the procurement in the right way. I think that today we will discuss a lot. We will talk about the future of the Prozorro Market. We will speak about the scaling up. Previous year has showed us how promising this tool is when we are telling our international partners that despite the war, despite the blackouts, we continue organizing procurements using an e-tool and we are doing it in an efficient way. Our partners are really surprised when they hear that. But I think that the preparatory work that we've already completed helped us adjust to the new circumstances. So I'd like to thank the team of the State Enterprise Medical Procurement who started doing it from the very beginning. They needed to have faith and they needed to do it for a number of years to be able to demonstrate the results that we see here today, the results that are really inspiring. Thank you very much. Thank you, Nadia. I remember when I just joined the team of medical procurement and we started with the e-catalog, nobody actually knew how we were going to do that, what tools we needed. And I was sent to Prozorro Stand Enterprise for some training. I was working with an expert, and that expert was Nadia Bihun, and we spent a lot of time together to understand the very idea of the value of the e-catalog. It's not just to set up some categories, you need to develop this category first, and to be able to do that, you need to have expertise, you need to have background information. Since we are creating a standardized procurement tool which will be used by most agencies that are doing procurement in Ukraine. And I'd like to invite Adam Adamano, who is the Director General of the State Enterprise Medical Procurement of Ukraine. Thank you for coming. I will not be abusing my time because I will still be speaking during one of the panel discussions. So for me, Prozorro Market is an example of partnership. Prozorro and Prozorro Market are one of the first successful examples of public-private partnerships, showing us how the ecosystem works. We have different stakeholders who either support or don't support different initiatives, and the Cabinet of Ministers passes some decrees which are later supported or not. So the algorithm that we're using is not that simple. We have a complicated ecosystem with different stakeholders. We have Prozorro, we have different administrators of e-systems, and thus it's quite difficult to discuss common goals, to find some common ground. And it's really motivating that in Ukraine we have this situation where democracy works, where public-private partnership is possible, and we've never had any serious conflicts over the past couple of years. And we are still pushing this project forward. And I would like to thank our partners for the support, because at the beginning the sales were not impressive and the hospitals did not want to do the procurement. And it's thanks to the international partners that the project survived. Thank you. Right now, I'd like to pass the floor to our partners. Uh, I'm inviting Robin Martz, Health Office Director of USAID. Robin, you're welcome.
Дозвольте представитися. Мене звуть Робін Марц. Я директор Офісу здоров'я USAID. Я рада бути тут.
Fine. Happy to be here. I cannot speak Ukrainian very well, so I will switch to English now.
Thank you. I want to acknowledge the government of Ukraine, the Ministry of Health, the medical procurement of Ukraine, and the people of Ukraine. Strengthening medical procurement systems is a key priority for USAID. We are proud of the progress that has been made in Ukraine since MP's establishment in 2018. I hear there's a 5-year anniversary coming up. I'm excited to attend. Even amidst the instability caused by war, this is impressive. We highly value the government of Ukraine's commitment to equitable, patient-centered care for everyone, and its willingness to dedicate a large portion of the health budget for medical commodities. It is essential to have a robust professional procurement bodies that save the government money while also delivering essential, quality-assured medicines in a timely and efficient manner. And MPU is such a model. Today, we are focusing on a critical procurement instrument, which has become available through the Prozorro Market. Under MPU, the Health e-Catalog initiative was launched in 2019, and learning from experience and introducing the necessary legislative changes, MPU has helped make e-Catalog a popular tool for healthcare institutions throughout Ukraine to procure medicines and medical equipment. Just this year alone, I'm told that Ukrainian healthcare institutions have saved approximately 44 million hryvnia, or an average of 23% of their health budgets. That's incredible. On the procurement of medical products by using this e-Catalog. These savings are especially important now, more than ever, during the war when resources are scarce and the needs for healthcare are growing exponentially. This tool is a great example of harnessing market principles for better health outcomes, something USAID promotes. E-Catalog, free of charge for health facilities and other entities, all the items in the e-Catalog are vetted with suppliers ready to offer their products, resulting in quick, reliable, cost-efficient, and convenient procurements. This year, over 2,000 hospitals purchased goods through Prozorro Market from more than 500 suppliers of medicines, medical products, and equipment. That is impressive. Encouraging regional purchasers to use the e-Catalog simplifies the procurement process for medical institutions, shortens delivery times, increases predictability of procurement, creates transparent competition, and equal opportunity for all market participants. USAID, through the SafeMed project, supports a multi-pronged approach to strengthening and institutionalizing the e-catalog. We see the value of increasing the number of medicines from the National Essential Medicines list available in the e-catalog and providing high-quality administration of the e-catalog to facilitate simple and transparent procurement procedures. We also hope that the MPU will be able to not only generate enough revenue to cover costs, but be able to use the profits from the e-catalog procurements to reinvest in the institution. As we look to the future, we at USAID are excited that Ukraine is implementing global best practices that respond to patient and hospital needs to support the goals and strategies of the Ministry of Health and the country. I wish you all the best in your deliberations. Дякую за увагу.
Thank you. Your Ukrainian is very brilliant, so that's good. Thank you very much. Далі я хочу передати слово Ребекці Кулер, яка
And I'd now like to pass the floor to SafeMed Project's Chief of Party, Rebecca Kohler. So can we see Rebecca? Rebecca, are you ready?
Yes. Can you see me?
Sure.
Yeah. Okay, great. Hello, everyone. Greetings, colleagues and partners. I just want to say it's a real pleasure to be here and virtually, and I'm very sorry that I'm one of the few people not in the room, and hope that that will change soon. So congratulations, everyone. USAID SafeMed activity has been serving, as many of you know, side by side as a strategic partner to the Ministry of Health and its state agency, Medical Procurement of Ukraine, to build a more modern, transparent, and efficient medical procurement and supply chain system that serves the needs of the Ukrainian health system and the clients it serves. Under MPU's leadership, centralized procurement of medical goods, of items on the nomenclature, has become a success story, saving the state budget millions of hryvnia. I know, but today we're actually talking about a different procurement instrument. At the same time, since the very first days of Russia's full-scale invasion, MPU demonstrated resolve, ingenuity, and willingness to take risks to ensure patients have the medicines they need. Their can-do, results-oriented attitude has saved lives, most importantly, but also saved time and resources. Over the years, MPU has won the trust and respect of other government counterparts, civil society, and its international partners. And today, MPU is continuing in that vein in our discussions today around the e-catalog. But today we're focusing on the e-catalog from the Prozorro Market. And as others have already said, this year, the catalog has outperformed expectations on many, many levels, and it has great potential for further expansion. The forum today serves as an opportunity to share experiences, identify priority actions for continual fine-tuning of this innovative procurement instrument. Hospitals and other healthcare facilities, along with regional entities, procure a majority of their medical commodities used by the Ukrainian health system. Having a tool that enables regional bodies to procure what they need more efficiently, more quickly, and more cheaply can be transformative. Those of you attending the forum from across the country, we value your inputs into e-catalog's future development. You, as the customer for e-catalog, have the power to help shape the tool to best serve your needs. We look forward today to hearing from you and hoping that today marks the beginning of the future for even greater heights for the e-catalog. I look forward to the dialogue today and to the coming weeks. Thank you, everybody, and have a productive forum. Slava Ukraini.
Дякую, Ребека.
Thank you, Rebecca. Thank you to our partners who have been side by side with us since 2019, and thanks to you for believing in the success of this project. And we are now proceeding proceeding to the next stage of our forum. This is panel number 1, entitled The Path to the Development of the Project. So I'm inviting Nadia Bihun, Deputy Minister of Economy, to take the floor. Having a discussion is actually a privilege that I would like to use. I would need to have a clicker, if I may, so I have prepared a presentation. Well, in fact, since we are having procurement people in our midst, I will not be telling you any new information. You all know what Prozorro Market is, but let me remind you about a couple of things. The clicker is not working for some reason. Maybe you could help me with switching between the slides. Well, actually, Prozorro Market as a tool has been in the works for quite some time, and let me tell you, we are at preparatory stage because Prozorro Market is preparation for open dynamic systems, and you know that in the EU they actively use this tool for centralized procurement. These are dynamic purchasing systems, and we even have them in our law already. We don't have the relevant bylaws developed as yet, but it's a new tool which is implemented differently in the EU as well. And when a couple of years ago we were thinking about ways of implementing of this tool in Ukraine, we understood that we needed to look at all of the options. So practically the e-catalog is a form of DPS, and we were testing how the instrument could be used in Ukraine. So since we are using
Коли ми дивимося на європейський досвід, ви знаєте, що далеко не у всіх
And
країнах є
if we look at the European experience, not all European countries have advanced e-systems that would cover the entire procurement cycle. So it was interesting for us to understand how this open framework, how the GPS could work within the e-system. And it's the year 2023. We already have a certain level of understanding, and we are working on the new version of the law. And this new version will help us harmonize our law with the European directives, and the new version will already include a working DPS mechanism. So we are working on the ID development, and hopefully next year we'll have the DPS operating in Ukraine, and it will be the next evolutionary step from Prozorro Market. So you can see that the scope of procurement via Prozorro Market has been increasing, and the preparatory work done has shown that indeed Prozorro Market is a tool for quick and simple procurement. When the full-scale invasion started and we were faced with the challenge of how to satisfy our emergency needs, for some time we did not follow any procedures at all, but with some time it became clear that regardless of the fact that we have a rather developed procurement community, it is Prozorro Market that's a tool for quick procurement. Even though we now have simplified open tenders, if we are talking about some specialized tenders, the application time is 7 days, but the procedure itself lasts for 25 days because we need to look at proposals, we need to rectify some of the mistakes, and it all takes time, and time is of value, especially amid war. And with Prozorro Market, the average duration of the procedure is 10 days, which is 2.5 times faster than with open tenders. And competition is one of the indicators of how well the procurement is developing or not. And when the full-scale invasion happened, we had the open tenders and we had Prozorro. And of course, the level of competition dropped because business has been affected by the war, and our participants often develop their proposals in bomb shelters when there are blackouts, and business is suffering from all the challenges of war. So, of course, we lost the competition in the system. Before the war, it was more than 2%. If we look at Prozorro Market, so the competition increased by 73. Why is that so? Because it's much easier for the businesses to apply. They don't need to submit a big package of document. The mechanism is simpler, so business is more willing to participate in such procurements and in such tenders. Of course, it influences the savings. In the big Prozorro, we have 7% in savings, and in Prozorro Market, it's 12.3% in savings. So this is the advantage for the customers to use this tool. And we have not really calculated how much it costs for the customer to organize an open tender and to participate as compared to participation in Prozorro Market. I think that it will be some 10 times if we talk about the difference, but we are talking about the result, and a better result is prepared by having this e-system. It's easier for participants to apply, the competition is higher, and as a result we have better savings. So what are our plans? We made the first step together with the state enterprise medical procurement. We added the number of items that were obligatory. Then we looked at the results. We assessed the results as positive. We now have 3 administrators in Prozorro Market. We have 3 different companies. And we started discussing that some categories should probably be made obligatory. So we are talking about electricity in this case, and all customers are buying electricity, but not all of them are doing it in the most efficient way. And we see great potential for savings if we are procuring electricity via Prozorro Market. So many customers are buying licenses for software, so it makes sense to look at this category as well. We will be expanding Prozorro Market. It's a tool for simple standardized commodities. So we are talking about construction materials, which is a direction that looks really promising, especially for the areas that have been really affected by the war. People need to do renovations and repairs. They have the worst situation with human capital. They don't have enough people who would do procurement, and we need to help them with that. So this is another area that we could look at. We have also added car spare parts to Prozorro Market. It's a new category. And if you've ever tried procuring spare parts, you know that this is a tricky process which requires a level of skill from you. So let's hope that we will be able to establish this practice of how to do procurement via Prozorro Market. That's practically everything I wanted to tell you. Should you have any questions, I'm willing to answer them. Or are we having a Q&A session later? Yes, we will have time for the questions after the end of the first panel, so we'll have some 15 minutes for a Q&A. Now is the time for you to prepare your questions, and I'm addressing our online participants. You can ask your questions in the chat. Now I would like to give the floor to Adam Adamanov, who will tell us about our success story with the e-catalog. So what do we have at the moment? Thank you. It's always nice to talk about success, but it has not always been that easy for us. Many participants are online with us. More than 300 people are listening to us. So for some of you, some of the information I will be presenting may seem simple or obvious, but it makes sense to discuss the ecosystem and the number of stakeholders because we get many questions from hospitals and we understand that there are some things that we need to discuss again. So what are we doing? We are not just working with Prozorro Market. So in simple terms, the government wants to supply free of charge medicines to special categories of patients. So the majority of these medicines are procured by us. So we are using the state budget funds and the taxpayers funds, and such complicated illnesses as cancer, orphan diseases are covered by state budget funds. So patients come to the hospital and they can get the medicines and treatment free of charge, and the NHSU pays hospitals for such services. Plus, there is also the initiative of the President, United 24, which has a number of directions, and one of them has to do with healthcare, and we are the designated procurement agency within this initiative. And we also argue whether we are a procurement agency or an IT company because we develop many IT solutions, for instance, various dashboards that provide you information about the stock, for example, but we also have other complicated systems that we use for demand collection. We analyze the use of medicines, and we are doing it ourselves with the support of our international partners. And a priority direction for us is administration of the e-catalog, Prozorro Market. So what is Prozorro Market? Everybody has already heard what it is. I'd like to thank all the speakers. It was really interesting to listen to the backstory, to the idea behind Prozorro Market, and the value. There are many questions that we are asked about the ecosystem itself. So, who is responsible for what? Where can we place our complaints? So, who should we approach to change the design? Who should we approach to do this and that? So, there are key stakeholders in the ecosystem, and there are four of them. The first stakeholder is the government, represented by the Ministry of Economy, and the Ministry of Economy is responsible for public procurement, and also we have the Ministry of Health. Another important role is played by Prozorro because they establish the architecture and they administer the central database. So all the information is stored somewhere. It's administered by somebody. It's stored in the cloud, and it's a great deal of work, actually. So we need to have a big team of people for us to be able to develop different new IT solutions. When we are talking about the administration of the e-catalog, we as the centralized procurement agencies, we have three procurement agencies in Ukraine at the moment. So what we are doing? In very simple terms, we are creating terms of reference. So when you're seeing a profile or a category, it's based on the terms of reference. And it's a difficult job because terms of references must be indiscriminate and must ensure a high level of competition, as was mentioned by the previous speaker. Another big chunk of work done by us, which makes the life of hospitals easier, is qualification of suppliers. So once per 3 years, we qualify the suppliers. That means that we give them access to the e-catalogs. So they don't need to go through the procedure every time. So they submit the document just once, and after that they are added to the catalog for 3 years. Of course, customers may file complaints against a supplier who violates the rules, but we haven't had many cases like that. Then we add the product, and here we have the bottleneck because we lack the resources to add a number of products at a time, because if we are talking about construction materials, these are thousands of unique products. And with this realization that we have a bottleneck, we are trying to stop having this as a bottleneck by developing some automation solutions. And the end goal will be for the suppliers to add the items themselves, and we as the administrators either accept this, approve this, or not. So the supplier may add their entire catalog, let's say 10,000 items at a time, and we are just checking and later approving. And the other thing that I mentioned at the very beginning when I said that we are a successful example of public-private partnership are the digital platforms. They ensure access to central database. So this is UIX. You see that these are the e-platforms, but not everything is that simple because it's the work with customers. It's also customer support. And if you've ever worked with call centers where hundreds of thousands of people are calling at the same time asking questions, this is practically what the e-platforms are doing, because we are having many suppliers and many customers, and all of them want to get the answers to their questions right away. They want to have their access restored right away. They want to know why the button is violet and not red right away. Plus, we are administering all the legal aspects, how the suppliers can be added to the platform. So all of this is really hard work. And sometimes we are having some conflicts, but I'm proud that over the years of us working on this product, nobody has refused to continue working with it. And it's an indicator of quality work and the ability to interact, but it has never been easy. The key indicators of the entire market have been mentioned by Nadia, but if we speak about our sector, so as of today, the scope of sales is a little bit over 500 million hryvnias. We have a little bit more than 2,000 hospitals as customers. Before the full-scale invasion, if we looked at all outpatient departments, we had 4,000 customers. And after the full-scale invasion, some of them were destroyed. And if we look at the system, we have a little bit over than 3,000 that are working actively, and more than 2,000 are using the e-market. And this is a good indicator for us. Then we have the number of categories, we have the number of suppliers, and the number of commodities. And these numbers change rapidly, and I will not be focusing that much on this slide. This information has been mentioned by Nadia already. So if we look at the general indicators and the indicators for medical procurement, then there are no discrepancies. So we see that the trends are similar, competition levels are higher than for the open tenders, the saving levels are better than for the open tenders, and for us who are involved in procurement on a daily basis, the efficiency is important. It's bad when tenders don't take place because hospitals cannot provide medicines to their patients. And if we look at the performance indicator, it's the most important benchmark that we use in reporting before the Cabinet of Ministers and the Ministry of Health. So, what does it mean? A hospital has procured medicines and patients will definitely get them. If we look at consumables such as construction materials and electricity, then the performance levels are much better for the catalog than for the open tenders. Savings. I think it's not really popular to discuss savings among people involved with the Ministry of Finances or Ministry of Economy. So because they have the budget, they plan to spend more, and then we have some savings. But if we are talking about medical procurement, every hryvnia saved is means more medicines, more medical equipment procured, or higher salaries for the doctors. And hospitals have now become more independent due to decentralization, due to the healthcare reform, due to the operation of NHSU. So hospitals are interested in high performance. They understand that the lower the price for the medicines, the more medicines they can procure, the more they can save, and the more they can invest in other areas. So we are willing to give them this tool that helps make their work more efficient and more transparent. Thank you. That's everything from my side, and I'm eager to answer your questions in the Q&A section. So let's look at that wonderful slide about the ecosystem. Why is it important? We, as the administrators of the e-catalog, get many phone calls from our customers and suppliers. Not all of the questions are ethical. So if we are having questions about the features of the e-platform, so there are some questions about how one can find products and items. But if we are talking about some terms of references, lack of some medicines, this is a question to the catalog administrator. Thank you for the presentation, and I would like to pass the floor to Rebecca Kohler, SafeMed Chief of Party. Rebecca, you're welcome.
Thank you, Adam, and great presentation. I'm going to share my screen. All right. So I'm going to present from the perspective of a little bit of an outsider. We've been hearing from Adam and others at MPU, and then other actors who are involved in the e-catalog. And this is a little bit from the vantage point of a technical assistance provider like SafeMed. Since we have so many in the audience who may not be familiar with the USAID SafeMed activity, just to say briefly, we're an activity that has been providing technical assistance to the government of Ukraine and the Ministry of Health since late 2017, with an emphasis on strengthening the pharmaceutical and supply chain system. And we have been involved in helping the creation and continual great success of the state agency MPU and the various components, elements of the MPU's mandate. And I thought it would be worthwhile to just step back briefly and say, what is the issue? What is the problem that we're trying to solve here in the health system with respect to procurement and supply chain systems, and the need for medicines for patients, greater access and quality of medicines. And the areas are really around three. The reason for tools like e-catalog, as well as other centralized procurement systems. And it has to do with lack of transparency, threats of treatment interruption, and then financial burden for clients, as well as the system itself. And beginning with transparency, the importance of having procurement procedures that can avoid the risk of corruption, can be quicker and avoid wastage, and also systems that enable purchasing of the right medicines that are quality assured and that are going to help patients. We also know that Adam even mentioned the critical problem of medicines not available to clients who need them, and that's essential for all patients, but in particular those who require their treatment on a daily basis. And then, of course, financial access. We know that despite the great progress in Ukraine on increased investment in in healthcare generally, and purchasing of medicines and medical commodities, we know that the highest out-of-pocket, the highest expenditure for health in the country is out of pocket, and we're trying to reduce that and have made great progress, but it's still high. And we also want to make sure that those who are responsible for procuring medicines, like hospitals, other regional entities, that they use their budget wisely. So that's the problem that e-catalog and other procurement tools are meant to solve. And the next slide, in terms of some of this data you've shared, and I want to acknowledge Adem indicated that numbers change rapidly. So the point in time that I'm looking at is really through end of August. But this is a picture of the history, a different vantage point of the history of the development of the e-catalog, specifically for health. As has been mentioned, it was really piloted early on in 2019 with very just testing it out, small number of customers, with, again, looking at products that were really of a low cost, low threshold, and sort of demonstrated that it had promise. And then in 2020, it was formalized through Cabinet Minister's Resolution 822, and it began its real life in serving clients. 2021 and 2022, as others have said, it started to have traction. More customers were using it, and many more products and items were on the catalog. It still was modest, and then the war, of course, caused a slowdown, a halting of it, and it took through end of 2022 to get back at a modest level. And then again with 2023, where really e-catalog has shown its potential and really grown. And in large part, that was the Ministry of Health and MPUs, as well as other actors, to really prioritize getting items on the e-catalog that would be of the greatest value to patients. And that is when the passage of the decree 688 to allow medicines to be on the essential medicines to be on the Prozorro, and increasing the threshold for types of medicines. And that's sort of the story of e-catalog in brief. And then moving to some of the results, you've seen them already, but here's a view of year-on-year progress in terms of value of orders throughout its life, beginning in 2019, all in hryvnia. You see the number that has been quoted, around over 500 million in sales. That's 14 million US dollars, of which the bulk of that has been in 2023 because of the changes that have been made. In some of the dynamics year on year, in terms of seeing the progression in terms of the number of items or unique items may mean the sum of the same medicines in different formulations, some of the same items, some of the same types of products, but different types. But items is sort of one of the ways to describe combination of the different products and different categories. But it just is an example that shows, again, some real growth on the part of 2020 and 2021 in terms of getting items onto the system, the pre-vetting of the items and the preparation of the terms of records. A lot of that happened in 2020 and 2021. And then suppliers, again, a real growth in the first couple of years, stagnation a little bit in 2022 for reasons already mentioned, and then growing that number. In terms of unique customers, you see the fairly large growth in the first year, where there's a lot of attention paid to that in 2020 after the pilot, and then again the expansion, again a repeated story around the expansion in 2023, and then here you have a number of orders and sharing the same story. Some of the savings I'm just going to present it in a little different way than the previous speakers. You see, this is just in 2023, the savings to the budgets of the customers. You see that the monthly saving in January was about 1.3 million hryvnia, whereas in August, as it again continued to grow, more people were using it, and the savings was 60 million, with average savings by month between 17 and 21. So where is SafeMed coming in, and what support have we and are continuing to provide? One of the things we've done over the number of years have been embedding consultants within MPU to be core leaders of strengthening the system, guiding it, working on a variety of tasks, as I mentioned, in terms of building out the systems, creating the categories, working with suppliers, and we'll be continuing to do that this year. We're helping MPU with the eye toward profitability for MPU of the system, and it's something that it's one of the core goals for MPU is to be able to generate sufficient revenue to be able to put back into MPU for additional investments in growing the business, while also being able to continue to generate the success in the indicators as Adem has described. And then with the continual improvement and expansion of the use of e-catalog in terms of better targeting, improving the customer experience, and enhancing the technological improvements. We know any online platform, we know tech companies are constantly adapting to make sure that it is as easy to use for as many people as possible, and using the experience, the feedback from providers. So that's again what the real focus will be in the coming years. So with that, I will hand it over back to Adem.
Дякую, Ребека.
Thank you, Rebecca. So in the presentation, there were numbers for the year 2019, and I remember how we started out that in 2019 we had just 6 procurements, and our first procurement was really funny. So we just had a mix up between Kharkiv and Kherson hospitals. There were some items that were not really on the catalog, but they were procured later because we were able to add those items to the catalog. Thank you, Rebecca, again. We are a little bit behind the schedule, so if you have any questions for our speakers from the first panel, please feel free to raise your hand and ask it now. Yes, so if I may. So there may be questions from our online participants. If those in the audience have any questions for our speakers, feel free to ask them.
Думаю, що просто нема питань, бо знову ж таки всі
There may be no questions because everybody here knows that they can use either Facebook or they already have our personal phone numbers, so they can just call us and ask these questions. But I think that the question that everybody may have is what will happen to Prozorro Market after the war, because now Prozorro Market is used as a tool for quick procurement, but there is a but. And here we have a discussion with the colleagues because they say that it may be difficult to talk to all the different stakeholders. I just remembered that we want to have the GPSs in Ukraine, the so-called open frameworks. So it's similar to a catalog, where the only difference being that there is an appeal mechanism. It's that kind of leverage that will balance the risks of potential discrimination. So on the one hand, we have our obligations before the EU with regards to harmonization of our legislation, and the threshold there is 133,000 euros. That's around 5 million hryvnias. So if we are talking about this threshold, an appeal mechanism should already be in place for this threshold. So if we have the DPS, we will be able to create analogs of the e-catalog with the appeal mechanism. And the second question concerns a debate that we are having with colleagues, whether the hospitals will be obliged to use the DPSs. And it's a debate because on the one hand, we understand that there is clear efficiency in the using of a centralized procurement agency. It helps us save time and resources. But on the other hand, if we look at the short-term perspective, this year, the upcoming year, we can see the advantages of super centralization. But if we are looking at the long-term prospect, where we are moving as a country, where the procurement is moving, then we understand that we need to develop small and medium-sized businesses. We need to develop our regions. And it's a continuation of the decentralization concept, the decentralization reform that is underway. For now, we don't have any systems in the regions. For instance, they have something in Dnipro and in Kharkiv. We have dialogues with other regions that we need to create expertise because it will promote the development of small and medium-sized business because a super centralization goes in the opposite direction from involving small companies in public procurement. Of course, healthcare is a specific area. It's not the same as supplying foodstuffs, and probably there you won't have small and medium-sized companies. So we have arguments for centralization of such procurements, but it's a question that's on the table that will require further discussion, and I think we have enough time for this discussion until the war ends. We will follow the same direction that we currently have, but when it's all over, we need to think how we need to involve regional procurement agencies so that they have their competencies on the regional level. And I'd like to have a continuation of this discussion, maybe not today, but in some time it will be really important for us. We are not against, really, we are not for centralization of everything. According to our logics, if we look at all the capable network of healthcare institutions, we will have around 3,000 plus active hospitals, and it will be important for us to make sure that these hospitals have quality products. And for the Ministry of Health, it's important that patients have quality medicines at a best price, regardless of whether we've procured them, whether the hospital has procured them themselves. So it is important that when money is spent on medicines, transparent tools are being used. And such tools need to have some protection mechanisms. We have our national medicines list, and it goes to say that this list is the primary list that the hospital uses in procurement. So sometimes we may have a lower demand according to the national medicines list to buy a more expensive alternative. So instead of helping thousands of patients, we are helping just a few. Thus, I think there has to be some regulation and centralization as far as medical procurement is concerned. For now, we don't have the unified manual and we have the CPV codes. And if we are talking about consumer goods, we are talking about the level of need. And with regards to medicines, we have just one code for all of the medicines. So if a hospital buys ibuprofen, everything that they will procure after that, for them, it's going to be a European tender, and the appeal may be involved. It all takes 3 months, so it's really complicated. Thus, we need to find a tool that will help us make this more efficient and more transparent. Thank you, colleagues. So let's thank our guests.
Що хотів сказати? У нас вже час
So what did I want to tell you? The time has come for a break, so I would like to thank Nadia and Adam. We're going to have a short coffee break for 15 minutes and we'll be back at 11:25. Thank you.
нашу другу панель, яка буде
So we are starting our second panel dedicated to the Prozorro Market tool as such. At the beginning, I'd like to give the floor to Mikhailo Radutsky. You're welcome. Good morning, dear colleagues. First of all, I'd like to congratulate the state-owned enterprise Medical Procurement of Ukraine with the victory that we all share. I even talked to the manufacturers and they said that in Ukraine they were able to sell some products even cheaper than the net price. So what medical procurement was able to achieve was actually why we created this agency. For the first time, we are having correct procurement in Ukraine taking place. So let me wish you that this is not your final successful procurement, but let me tell to our audience that we've been working on a law together with the Medical Procurement of Ukraine, the Ministry of Health of Ukraine, and practically all of the law enforcement agencies other than the State Bureau of Investigation. So I'm talking about NAC and others, and I really hope that the Verkhovna Rada will approve this law. This law will indeed enhance the transparency, accessibility, and savings. So these are practically what the objectives of medical procurement of Ukraine were from the outset. And if this law is approved according to our calculations, but we may not be very professional with the maths, maybe NABU and the Security Service of Ukraine and the National Police of Ukraine, their Department of Strategic Investigations may be better at calculations. So all this will help us save between 40 and 120% of the budget that is currently allocated for procurement. So we are talking about procurement of the so-called expensive equipment starting from 120,000 euros. So you remember the case when the Cancer Institute was doing procurement themselves and the other hospital was procuring via Prozorro, and the difference was drastic. And we currently have investigation with regards to one hospital in one of the regions, and on live air, the hospital representatives were discussing the procurement of an angiograph, and they were saying that they need some 19.5 million for that, while the supplier said then set the price at 20.5. At the same time, we are having a different situation where the same equipment can be bought at 9 million. So you can just imagine what's happening in regions. Prozorro Market is a good tool, but we need to add advocacy of procurement. Because when you start asking, last week we just had a conversation with people in Dnipro, in one of the regional hospitals of Dnipro, at the oncological hospitals of Dnipro, they have 266 million left on their account, and they were trying to get an MRI from the Ministry of Health, and I MRI equipment, and they told me we don't know where to get the MRI equipment. We need to negotiate. We don't know how to do that. So while you're having this brainstorming today, please don't forget that medical procurement is not something that the Ministry of Health is only using. Prozorro Market, the e-catalog are the things that everybody can use. And I recently saw an interesting comment on social media. So those people that bought something for 70 million, will they be punished? So we don't want to be asked the same questions anymore. So this is a task for you. People in Kyiv are all smart. They know all the manufacturers and all of the suppliers. While in other regions and cities, in particular in small towns, it's difficult to ask the same question. So I think we need to talk about advocacy of Prozorro and the e-catalog. Communication is important. It's important to communicate what opportunities one may get by using these tools. Politicians always say that the predecessors are to blame, and let me reiterate from all the legacies that we've received from the previous politicians and members of the cabinet, there are two things. That's the NHS2 and the medical procurement of Ukraine. So we really want for the e-catalog, when there is a change of government, to be in hand. So we want for the new government to say that medical procurement is the best legacy that they got from the predecessors. So I wish you good luck. I wish you to be successful in what you're doing. Thank you. So let us continue our forum. Could you please put my presentation on the screen? So we are going to be discussing the e-catalog in general, and we will focus our attention on the medical section of the e-catalog.
Є, як формується беклог, і по якій
So we will be discussing the backlog, the sequence of the categories being introduced to the e-catalog. So we have a number of approaches. Number one being the analytical approach. So we are looking at what the hospitals have been procuring for a certain period of time. We are looking at popular items that are procured by the hospitals via open tenders or maybe via simplified systems. So these items find themselves in the catalog. There's also a different way. A hospital may always approach the administrator asking to create a specific category so that we can have specifications for specific goods. So these are the two ways how categories are added to the e-catalog. As far as the technical side of things is concerned, so we have the fourth level. In fact, so we have the fourth sign. This is the architecture of the e-catalog. And when the hospitals are reporting on procurement, the reports go via 33 and 6. We've had some amendments that my colleague will tell you a little bit more about. We only have one tool left, which is request proposal. So under this instrument, the procedure looks in the following way. So how can you use the request for proposal? Of course, you need a plan. Then there are some profiles of products, but this specification,
Товару. Ми робимо пропозиції.
we are not creating requests for specific goods, we are creating specification. Then we proceed to the auction itself. The duration is 2 days.
Самих постачальників зробити таким самим собі конкуренцію, вірніше не собі, а постачальники конкуренцію на запиті пропозицій, то варто, наприклад, подовжити її до 4-5 робочих днів. Після цього йде автоматичне визначення переможця, тобто система
There
сама
is an automatic period of the system to offer a more economic.
боку самого замовника. А знову ж таки, про змінах ми поговоримо. Там з'явилися цікаві речі в 822 постанові, де в яких випадках може сам замовник
There are some changes here. There is Decree 825. There are new updates, and the criteria has been selected there. And then, when the request has been approved, a proposal comes for the conclusion of the agreement between the supplier and the customer. So this is an economic agreement, and after the agreement has been signed, and it should be signed within 10 calendar days, the agreement is published in the system. The procedure itself is quite simple. When we are talking about a request of proposal, a lot has been mentioned. There are some videos that you can consult, and it will help you develop the proposal request. It's quite simple. When we are talking about Decree 686, which introduced a list of medicines and medicinal products that are obligatory for procurement via the e-catalog, we are talking about a threshold of 50,000. So if you're doing procurement of medicines or medical products outlined by this decree, starting from the sum of 50,000, you have to do it via the e-catalog. We have 128 categories of medicines and 36 categories of medical products. Very often the question is whether you can buy it via the e-catalog. Well, if the threshold is below 50,000, yes, you can still do it. Moreover, everything that you can find in the e-catalog may be procured by you, and this is all legal. So this is the most reliable way and method to procure any medicine or any medical product. If we are talking about the results, then over the 8 months, including August, hospitals have used this tool to conclude more than 2,000 agreements for the sum of 213 million. So if we are talking about the savings, it's 24%. We are talking about the medical section of the catalog here. So the expected price of the 11 items was 36% higher Then it turned out during procurement, and competition here is really important. So there were 3 participants to the procedure, and it took 7 days for the entire procedure to be completed. And the procedure may be even faster, so the customer themselves chooses how many days the tender lasts. Then we have the Kyiv Regional Oncological Center. They were able to save 46%, and the duration was 8 days with 5 participants. And Dnipropetrovsk region, according to their performance in August, they take the second place according to the number of tenders of the Kyiv region. So if we disregard Kyiv and Kyiv region, Dnipropetrovsk region has been the second over the past 2 months in using the catalog. So I've already mentioned the competition. And when we are talking about the use of e-catalog for procurement, we can clearly see that it simplifies the procurement procedure. You don't need to qualify the suppliers. You don't need to create terms of reference. You don't need to wait for 35 days for the procedure to be completed as it is with the open tenders. When we are talking about the speed, the average duration of procurement is between 9 and 10 days. So we are looking at indicators of August. In the e-catalog, all the suppliers have been pre-qualified. So this tells us about the reliability of this instrument, and of course we are talking about savings. Hospitals will be able to buy more medicines because of the savings, and they will be able to cover their need. If we are talking about the development of catalogs, we have some questions. Will we add new categories? So the situation changes because the suppliers may be able to exchange the agreements in a convenient way. There is a tool that we are testing for adding items to the e-catalog. It will help us expand the e-catalog itself and make it more competitive. Specification. So you can use the instructor to create a specification if you haven't found it in the e-catalog at a specific category. With regards to assortment, we can work with expanding the lists, we can work with adding new items. In addition to the national medicines list, we will add another 300 items. So practically that's all from my side. I'm asking you to prepare your questions, and I'd like to pass the floor to my colleague Alexander Fasenko, who will tell you more about the changes in legislation. 1, 2, 3, can you hear me? Good afternoon, thank you. My name is Alexander Fasenko. I'm head of the Department of Legal Support of Medical Procurement of Ukraine State-Owned Enterprise. And today
У нас відбулися в постанові 722, яка регламентує порядок формування і використання електронного каталогу. Дуже, до речі, знаково, що нашу панель другу відкрив Михайло Борисович Радуцький, голова комітету Верховної Ради України з питань здоров'я
the
нації.
Verkhovna Rada Committee for Public Health opened our panel discussion because the committee has been supporting us in our activities. They are the subject of a lawmaking initiative, but together with them, we are trying to develop some amendments to the existing laws or to develop new laws so that we can improve our environment and reach the highest indicators of savings for the hospitals and for our budget. If we take a look back, the e-catalog did not appear in the law on medical procurement that we've had since 2016. It was added in the revision of 2020. And Article 1 of this law on medical procurement, the new revision, provides a definition of an e-catalog that is a systematized database of all the relevant offers where procurement happens with the participation of the medical procurement agency via centralized procurement mechanism. In autumn of 2022, e-catalog was not such a popular tool as it is now because there was a threshold of 200,000 hryvnias. So the majority of hospitals and public customers did not use the e-catalog because their need exceeded 200,000 and they immediately went to open tenders using the instruments regulated by the law. Then the other article of this law tells us that the e-catalog is created and administered by the centralized procurement agency, and we know that our CPA is the state-owned enterprise Medical Procurement of Ukraine, which was established in 2020. And the activities of the CPA for regional customers were launched in 2021, and when the full-scale invasion started, we had to suspend those activities, but within 1.5 months, we were able to conclude 13 agreements, and we were able to supply medicines and medical products to hospitals.
This goes back to what Mikhailo Raditsky said, that we want to expand our expertise also for the administration of the e-catalog. And thanks to the central procurement capacity, and we know that we now have the new draft resolution that has been developed by us, and I guess that we will share our experience and we will help hospitals save as much as possible through this procurement tool. As I already mentioned, on the 24th of February 2022, we got this full-scale invasion. And as the minister has said, nobody was interested in the process. Everybody was interested in the outcome. That's why we got resolution number 169 that simplified the procurement procedure to the maximum extent possible. We deviated from the law on public procurement in our procedures. This resolution provided an opportunity to the public customers to use the e-catalog tool with no price threshold. This price threshold was removed. Before that, it used to be 200,000 hryvnias, and everybody started using this tool very actively to make procurement because there is the norm that it's not allowed to buy services and goods without the use of open bidding or e-catalog. Adam has mentioned about the achievements and about the benefits, and in fact about the achievements and about the benefits. And in fact, the resolution we are now discussing and the resolution Vitaly has told us about, it's about the list of medical goods and medicines that have to be bought via the e-catalog. Was not an easy path to take, and at the beginning we were not supported even by our profile minister when we came to them and said that we have got some figures, let us give you those figures, and here is the proof that e-catalog is a very effective tool, so let's introduce this tool. But they said that no, that would come as a restriction. We cannot apply this. That's why we took a different way, a different path. And again, getting back to Mikhail Radutsky, I would like to say that it is the law enforcement bodies that are the best in calculating figures. That's why we went to the National Agency for Corruption Prevention, and we said that let's introduce the item into the anti-corruption program on the medicinal products and medical goods that are obligatory for procurement by regional customers. And you can see that this paragraph was introduced into the national program. And then the Ministry of Health got already engaged in that. And they decided to initiate consideration of this draft. And in October 2022, we got this regulation passed. But in fact, we initiated it in July, and we've already got some success. That's why nobody waited till October. And I think that in October, we will already manage to report about the fact that this tool should not be a temporary tool as it is now stated in the resolution 1178, but it should be a permanent ongoing tool. And today we have already heard about the hopes that this tool, these mechanisms would be valid not only for medical goods, but for other goods. And this is a very effective tool. And you will see that the resolution 1178 has been amended in a way that we have expanded the use of e-catalogs for a specific list of goods. And these are not only medicinal products, but also medical goods. And today we can already see the savings achieved thanks to this tool. But that was not a point to stop at. And today we have already heard as well that we keep communicating with the suppliers, with different platforms, with our customers. And the Department of Procurement with the Ministry and the State Enterprise CPA and the State Enterprise Prozorro are helping us a lot with that. We've got ongoing regular meetings, and one of such regular meetings that we have had was dedicated to working on the amendments and to the regulation on the improvement of the procedure of using e-catalog. These amendments became valid in 2023 on the 1st of September, but now we're still working on some further amendments related to the e-catalog, and these amendments presuppose that it's obligatory to upload draft agreements there. So we used to have the procedure when the suppliers did not always had a chance to see the agreement under which they would have to work. But we know that the terms of the agreement concerning bank guarantees, advance payments, and other things like that. So these are the terms that can affect the price. And if the terms are not dragon-like, the price could be lower. Otherwise, the price could be proportionally growing. So now it's a binding condition that it's necessary to upload this draft agreement beforehand. We are also now working with this tool to have not just the agreement or the contract, but to have a template that would be used by hospitals. So we've got some expertise as far as central procurement is concerned, and we can also use it for hospital-based procurement, and we can make the life of suppliers and customers easier for them not to reinvent the wheel and not to introduce any illegal things into the contracts. That is the common unified procedure which we have now, and it enables to hold many auctions in the e-catalog itself. And we have seen the list of grounds for refusing, for rejecting the winner's bid. All the terms are prescribed very clearly there, and we have added a paragraph saying that if the supplier gives the proposal, it may be considered that he has the intention of concluding the agreement. And also amendments have been introduced into Resolution 822. And now the Ministry of Economy is developing a new version of the law on procurement in Ukraine, because the requirements of our international partners are that we need to get back from some temporary procedures to the legal regulation of the procurement procedures. So that's why we are now also working with Prozorro and with the ministry on the inclusion of some of our elaborations into the new version of the law. That's all for me. Thank you. Thank you, Alexander. Let me now give the floor to Alyoshka Dmytro, who is the managing director of the Legal Alliance firm, and we will talk about the ways of improving the catalog by introduction of changes into the legal acts. He's going to have a very interesting presentation, so let's listen to him. Yes, thank you, colleagues. So first of all, I would like to express my gratitude to you for inviting me to such an interesting event.
Ми можемо разом поговорити про шляхи удосконалення електронного каталогу через пропозиції щодо внесення змін до нормативно-правових актів, зокрема і тих, про які
We can be talking about the amendments to be introduced into the regulatory acts, suppose the ones Alexander has just mentioned. So what have we done? We have communicated with a number of customers and with a number of suppliers, and we have heard a number of suggestions from them. We have heard about the challenges and about the issues they have been facing while using the e-catalog. Then we studied the experience of other countries where they have the best practices of e-catalog application, and we tried to found some solutions to the challenges voiced by our suppliers and customers that have been identified here in the Ukrainian territory. We have taken the experience of Singapore, because Singapore is the country where the rate of corruption is the lowest in the world, almost the lowest. We also took Lithuania, because it's a small country, but this is an EU country, an EU member state with good system of regulation. And we also had a look at the experience of Indonesia, where they have also been quite successful in the application of the e-catalog. And when we were making contacts with the suppliers, we gave a call to one of the two large distributors in Ukraine, and we heard from them that so far they are not using e-catalog at all. And that answer came as a very strange answer as for me. But on the other hand, I realized that this is a very good signal, which shows us that really a competitive environment was created, and both small and medium-sized enterprises, suppliers can use e-catalog, and there is no pressure, there is no discrimination, which is otherwise present in all the other supply procedures if we apply other distribution chains. And if we get back to the experience of those three countries I've mentioned, in Singapore, if the procurement is up to 6,000 Singapore dollars, it's about 4,400 US dollars, then the customer can and has the legal right to make a procurement via the e-catalog. He can do it independently, even without giving any bidding proposals or price proposals. So this is bought not out of the budget money, and when the amount is under that threshold, they have such an opportunity of doing this independently. That is about Singapore. Concerning Indonesia, if the procurement is under 13,000 US dollars, then this procurement can be also made independently by the customer. But if it's about that limit, this can be done only through the CBA. And in Lithuania, if the procurement is under 15,000 euros, then the price proposal should be made via the e-catalog. That's the way it functions in Ukraine. The procedure of registration or qualification of the supply in Ukraine and in those 3 countries, well, I would like to characterize it. So all in all, the major items coincide with these countries and even other countries we studied. That is what you see in green. But in red, you can see something that is inherent only in Ukraine in our system. Suppose the certificate from the Unified State Register of people who have taken some corrupt acts or accept from the information analytical system the data on the person being brought to criminal account. So this is something that only Ukraine has and no other country has. And to tell the truth, I think that probably we need to get rid of those mandatory things, and we need to rearrange the system in the way for this data to be automatically taken from the registries. I don't think that our IT field cannot provide solution to this problem. This is not something very complex. And also, if we speak about Indonesia, they have a very interesting point for a specific category of goods, in particular for medicinal products. The supplier needs to indicate the profitability rate. I'm not urging you to introduce this in Ukraine because it's going to be difficult, but they have such an experience. And as far as Lithuania is concerned, only after the supplier is cited as the winner in the procedure beyond the e-catalog. It's only after that that the representative of the e-catalog contacts this person or entity and sends out the form he needs to fill out in order to be included into the e-catalog and be qualified for this procedure. As far as possible breaches are concerned, that would lead to disqualification of the supplier or some liability. Well, we have the same principle. In green, you have the things that coincide with other countries, and in red, we have marked the things that other countries don't have. And suppose in Singapore, one of the grounds for disqualification is supply of poor quality products, which we don't have, and also notification about improper fulfillment of the agreement for 5 or more times, or unauthorized conclusion of subcontract agreements. Well, also in Ukraine, we have a specific procedure that for 90 days the supplier can be blocked, but that does not do a disqualification. That is just freezing of operations due to a number of breaches. And also in Indonesia, they also have disciplinary accountability for officials. And in Lithuania, they have professional violations, professional breaches, suppose conclusion of a banned agreement, if the competition agreement is competition law is violated, or if they do not comply with some tax payment criteria. As far as adding of new proposals is concerned, well, Vitaly has already mentioned this, and it's true that we have got this experience. And suppose in Singapore, adding it's possible to add a good to the catalog after you fill out the registration form. So the supplier can do it himself, and I would urge all of us to do this also in our system, because that would simplify the system in our Ukrainian e-catalog. And as to Indonesia, the situation is the same, and in Lithuania, they currently have the same system as we do have. But I would, of course, urge you to use the best practice. Well, here are some issues, some challenges that we have heard about while negotiating with some suppliers or customers. I think that these problems were more present at the beginning. Some goods were not in the e-catalog, and sometimes there was a real that was a real challenge with the mandatory range of goods, because the customer can have a repeat request, and if in case the procurement has not taken place, but in this specific case they couldn't even launch it, and that was a technical problem, a technical challenge. which of course needs to be solved by the CPA and by the state enterprise Prozorro, and amendments to Resolution 822, an introduction of the possibility of adding new items by the supplier will actually solve this problem automatically. So I think that we are moving in the right direction. Then ungrounded requirements, that's another problem we heard. According to the general rule under Resolution 822, the terms of the agreement cannot differ from the terms set by the customer in the draft agreement. But we have heard about cases when the supplier refused to fulfill the commitments undertaken within the agreement because he said that here we don't have this commodity, we have a similar commodity. So we either refuse to fulfill our commitments or please take whatever we have. And for this, we have the international experience. Suppose in Singapore, it's possible to disqualify the supplier for a number of reasons, one of which is default of the fulfillment of the agreement. And in Indonesia, for such default, there could be imposed punishment in the form of a fine and prohibition of participation for 2 years. Well, I'm not sure that we should be that strict, but some changes need to be introduced here. Concerning the qualification system, some of the customers, while they consider the proposals, demand from the suppliers some documents that confirm their that this is possible for them to fulfill their commitments. But this is the story that has migrated here from the open bidding process, and it's controversial. And by the way, when in 2014, after the Maidan, in the Ministry of Health, they were making the reform of procurement, the team dealing with the reform suggested as one of the first things to get rid of such controversial entities because they consider it to be a level of discrimination and narrowing the environment. And there were also cases, and even now we have cases when the suppliers indicate a good which is not a medicinal product in the e-catalog, and it can go together only with the certain producer's commodity, but the producer did not actually give any authorities for the distribution, for the supply of this commodity to Ukraine. He generally doesn't know about anything like this. So I think that this case will soon be considered by the state enterprise. It's about one Chinese company, but with this in view, we need to introduce changes. In Lithuania, while they register the supplier, they hold the verification of the supplier in order to check the specifications of the list of goods. In Indonesia, when the goods are registered, it is required to give the information on the number, on the amount of goods that are currently available. And I think that we could borrow this experience and use it for our system to at least be sure that if the supplier is qualified and he has the required goods, he understands that he will be able to supply these goods on a regular basis. And by the way, we are now facing the following issue. There is one medicinal product which is very important, and there have been a number of procedures undertaken in relation to it under the e-catalog, but the producer does not supply it physically to Ukraine. So what do we do then? So I think that this the thing I have mentioned could act as a preventive measure in such cases. Also, appealing the activity of the customers. Our resolution presupposes the procedure of indirect procedural appeal against the actions of the supplier, but not the actions of the customer. In Singapore, they can actually appeal the actions against the actions of the customer in case this appeal is well grounded and if there is a gross violation of the law. So the CPA in this country is obliged to convey the information to the Ministry of Finance. In Indonesia, they can also appeal against the actions or omission of action by the customer, and in case it is identified that there has been gross violation of the competition law, this appeal needs to be conveyed to the respective bodies. And here is another experience that we could possibly use. That's something that we saw while working with those countries. This is a unified qualification system of qualification of suppliers for participation in e-catalog and in other procurement procedures within the system. I think it would be great to introduce this unique system. It would be a major step forward. This one is not related to foreign experience, but that's something we heard of. Communication between the parties and between the administrator is something that may be regarded as a very tedious and long-lasting procedure. So we need somehow to resolve this problem, but this is just a matter of practicality. It's not about legislative framework or amendments. Using e-catalog for other procurement procedures, in particular for goods, well, it somehow overlaps with the first item. And this is also important. And with this in view, we need also to work with some tools, with the elaboration of some tools. Our suggestion is that we need to take into account the experience of Singapore, and for the medicinal products for which we have state regulation of prices and where we have the marginal price set by the Ministry of Health. So probably we should provide an opportunity to buy them as in a shop. Direct procurement with no request, because the price is anyway set by the state. So probably it's not an easy issue to tackle, because it will not always lead to savings, but anyway, it will facilitate the very procurement process, and it will accelerate all the process we have in place. And the last thing, which is not indicated here, but I've already heard today about savings, but we should also focus on the quality. And here we may ask a question which is not referred to the Ministry of Economy, to the Ministry of Health, or the CPA, or the state enterprise Prozorro. It's related to registration of medicinal products, in particular in the first 20 years of the independence of Ukraine. What do we do with most of those medicinal products which have already got registration for an unlimited period of time? So how can they possibly compete with high quality medicinal products? That's a real question. And one of the directions the project SafeMed is dealing with is bioequivalence. So maybe we could also engage this mechanism when in such procurement procedures, we should have only the drugs that have confirmed bioequivalence as stated by the state expert center on the basis of registration materials. Maybe we could take this path, but anyway, savings are not always the best criteria. It's good, but if a patient has been taking certain drugs for years and you claim that, oh, wow, it's cool, we have bought it, it's cheap, but it's not what he actually needs and what his body needs. So it's not always that simple, and it's not always that you can make a person switch from one drug to another one in a very simple way. So these are the major issues, and I think that we will together discuss those issues on, and we will improve our e-catalog. So thanks again for the invitation. Thank you, Dmitro, for your precious comments. We have already changed a lot of things in the legislation in relation to the tools that will allow our suppliers to ship the drugs and to increase the amount of goods, the number of goods indicated in the e-catalog. But here is also another question on the reference prices. You know, in the e-catalog, reference prices are inflated. And when the procurement is made for those goods via the e-catalog, the prices are much higher than the reference prices that we find in reality. So this is something we need to work on. And your presentation has been very nice, and we definitely need to think it over what we could what lessons we could take from the experience of other countries. So our panel is over. I think that you've got some questions to the participants. So let's ask questions. Just raise your hands and ask your questions.
Якщо немає залу питань, є у нас питання,
If
які
there are no questions in relation to those presentations, we have got some online participants, and there is a question. Unfortunately, the internet connection is very bad. So, can we buy goods in the e-catalog for the amount of more than 200,000 hryvnias? But you have mentioned that there is no threshold, and you can buy goods for any amount, for any sum via the e-catalog. There are a lot of questions online about absence of goods, shortage of goods. So let's clarify the situation here. In fact, the e-catalog is not about having all the goods, all category of goods represented in the e-catalog. E-catalog embraces the categories of goods that are popular among our customers, and there could be thousands of them, there could be hundreds of them. We just need to take the ones that are most popular. But what do we do if there is no certain good in the e-catalog? Today, I heard very good feedback from our team, from our managers. They said that the response is very quick. Yes, we create profiles on a very quick basis. As far as goods are concerned, and if we speak in particular about medicinal products and medicinal devices, we need to definitely understand that if suppliers come there, they give these commodities and we register them in the key catalog if we speak about medical goods. If we speak about medicinal products, about drugs, it's a little bit easier because we have got the registry of medicines and we can actually take the medicines, and the situation there is simpler, it's easier to follow. Most suppliers are large distributors, but we've also got some small distributors, and they are providing only the goods that are registered in those registries. Unfortunately, the connection is very bad. We've got some categories of goods, and if you want to find some competitive commodity, if you want to buy it, again, you have to address the administrator, and he will add this commodity to the e-catalog. And I would like to stress that it is the request for the proposal that is the major thing. You cannot make a request or a proposal for a specific commodity because we've got the law on public procurement, Article 24 of this law, and we need to comply with the legislation, with the requirements. How do we prescribe the requirements to the object of procurement? That is the question which is frequently asked. But we do have specifications prescribed, we do have terms of references, and we all know already how we can prescribe all that. There is no need to describe something else in the requests, in the inquiries. That is already done according to the legislation. So we have specification for that, and we just need to make the inquiry and work accordance with the specification. And I would ask you to comment. So, do we have the list of punitive measures, of sanctions? Suppose the supplier violates the requirements. Well, sure. There can be punitive sanctions, and the punitive sanctions are based on the days of delay, and the fines could be no less than 7%, but could be much higher in case, in particular, the delay is more than 30 days. And there could be also additional sanctions, additional punitive measures. And if the supplier understands that he doesn't have a certain commodity, so he cannot do anything about those sanctions, no matter what these sanctions are. So this can really affect the cost of the commodity. But the fine for delays should definitely be indicated in the contracts. Thank you, Alexander. The customer must buy the cheapest commodity regardless of its quality and regardless of the fact that it does not comply with the technical conditions. So the only thing we can do about it is creating competitive terms of reference, because the system definitely automatically chooses the winner who sets their most economically beneficial proposal, bid, right? But we need to think about some sensitive categories of goods that really require high quality. So I guess that this issue could be solved through their prescription of all the information in the terms of reference in the contracts. If the procurement is for the amount of less than 50,000 and there is only one bid, so can we buy the goods via the Prozorro sales? By the bid, do you mean the number of suppliers or the commodity? Because we've got several bidders, and of course, if you have several bidders, you can do the procurement via the e-catalog. And we don't have a different procedure. We have just the request and the bid. And we have deviated from the format when the supplier could see the very customers, and the customers address them saying that the prices in the e-catalog do not correspond to real prices. That's probably because the suppliers quite often fail to change their prices in time, in particular under martial law. We position Prozorro Market as the market of relevant prices, and the request is obtained within this process. Unfortunately, the connection is very bad. Sorry. According to one of the resolutions, we've got a structure according to which we can determine what the amount of our procurement could be. And we could determine the information about the characteristics of the goods and specific brands. And the cost could be up to 500,000 hryvnias. Alexander, probably you will give the answer. Unfortunately, it's not possible to understand what he says. Such bad connection. It would be good if the e-catalog contained absolutely everything, but that's not yet possible. And our experience shows that the e-catalog is expanding And of course, we should first add some categories, and then there'll be another round of expansion of the e-catalog. But we have to start with something, and I have told you how we can add categories to the e-catalog later. Any other questions? So it's about narcotic substances, whether it's possible to add them. So you can actually buy the CPU code 33 and 36. What about narcotic substances? The requirements for them are specific, and this category goes separately from all the other medicines. Well, I'm sorry, but we are already pressed for time. Thank you, dear colleagues, for your participation. Thank you for your questions. Thank you for your answers to the questions. So we are going to start the third panel that will be dedicated to the ecosystemic nature of Prozorro Market. It is an ecosystem. It has many stakeholders, and we've got our colleagues who are stakeholders of Prozorro Market. These are the people who fill the catalog. And let me now invite Transalyanka, who is the head of the Department of Support of e-Catalog in the State Enterprise Professional Procurement of Ukraine. So he will share his experience. The floor is yours. I wonder whether you can hear me, because there are a lot of claims that nothing can be heard, that the connection is poor. Let's hope. Well, I hope that you will still hear me and there will be no surprise with the connection, internet connection. Sorry for that. So let's try to anyway find a way out of the situation. I'm Metro Solovay, and I'm the representative of the State Enterprise Professional Procurement, which is the first central procurement organization in Ukraine. And I hope that you will be able to share my presentation. I just don't understand. People online cannot see my presentation. Am I right? Vitaly is not willing to answer. He's just ignoring me. Okay, let's proceed. So, as I've mentioned, as Vitaly has introduced me, I represent the Central Enterprise Professional Procurement, which is the first CPA in Ukraine. And it stems from the title that this is a highly professional entity, real professionals in procurement, and this is the best CPA in Ukraine ever, in my personal ranking, of course. That is the team of category managers and lawyers who have been making procurements for more than or almost 5 years. Oh, sorry, almost 7 years. That's why we've got quite a great experience in making procurement, and that is the organization which is mandatory unit for the ministries. So besides administration of the Prozorro Market, we also make procurement, and we make this procurement in accordance with the law, which means that we know from the inside what the difficulties are that the customers can face within the system. And administration of the Prozorro Market is the main topic of our today's meeting. And it's true that we are the first administrators of the Prozorro Market, and together with our CPA and Medical Procurement of Ukraine colleagues, we started this story several years ago. So if we speak about the achievements, with all my due respect for my colleagues from the CPA Medical Procurement of Ukraine, whom we love very much, And still, our institution is the centralized procurement agency which administers the most popular Prozorro Market categories. 90% of sales in Prozorro Market are taking place in the categories where we have qualified suppliers and specifications for which have been prepared by our experts. And the scope of agreements in our directions, which are food and energy, exceeds 7 billion hryvnias. And over this period of time, our customers have signed more than 50,000 agreements with suppliers, and more than 7,000 customers have used our services, and we have managed to qualify more than 3,500 suppliers. If we speak about the use of Prozorro Market, well, a positive factor had already been mentioned by our colleagues from the Ministry of Economy today and from the CPA of Ukraine. So the main lever of our influence on the state customer is, of course, regulatory framework. And since October last year, we've had the resolution of the Cabinet of Ministers of Ukraine 1187, which regulates public procurement for all the customers over the period of martial law and within 90 days after it is over. So we have this resolution, which is the core instrument of procurement, and we can see that starting with November last year, in the monetary dimension, the amount of sales increased, and we have been witnessing the growing trend up till now. Maybe it's due to seasonal nature because the public customers buy differently in different seasons, but we will hope that the results will keep growing up till the end of the year. A couple of words about the categories we administer. This is electricity, this is coal, this is wood. These are the things which are bought on a competitive basis, and these are the things everybody needs. And hospitals, enterprises cannot exist without power, without food. So also quite a number of customers buy food. They also buy office equipment and all the other categories that have nothing to do with the medical direction and that have nothing to do with the computer direction. My colleagues will tell you about. The main well, I will not focus in detail on the Prozorro Market because I see that we're pressed for time. And again, this information has been covered by the colleagues from the ministry and the colleagues from the CPA. But in the categories that we administer, the competition among customers is higher. And during the requests for price bids, the median of savings exceeds average indicators 4 times. In Prozorro Market, you can effectively use different volumes and for the most diverse objects of procurement. Suppose here is one procurement when at the beginning of this year, the supplier was buying power. They bought 600,000 kilowatt hours of power. And thanks to the pre-qualified suppliers and automation of the procurement process, we managed to complete this procedure within 7 days. And the amount of the contract was more than 2 million hryvnias. And again, the pre-qualified suppliers, the object of procurement was standardized. So we got the competition of 18 bidders, and the customer managed to save more than 20% of his budget. The other example is buying food, procurement of food. Again, a large-scale food procurement because one of the departments of education in Kyiv was going to buy 25,000 tons of berries, and we did it within 25 days. The competition was 5 participants, and again, the customer managed to save 20% of the budget. But it works not only for large-scale volumes. Prozorro Markets works well for small batches, and one of the permanent customers that buys that makes more than 100 procurements in Prozorro Market. So, in fact, that was about buying 10 tinned corn. It was not necessary to have this open bidding procurement procedure, but actually he decided to do it, and the amount of the contract was less than 5,000 hryvnias. But he didn't go to any supermarkets. He did it here, and he saved about 1/3 of his budget. And he did it within 7 days. Then electricity is one of the most popular goods traded in Prozorro Market, and soon we will have the season for electricity. So it would be good if we could motivate hospitals to buy electricity for next year using the price bid system. And normally we have about 9 participants per one tender. So you can start making the procurement under your sole proprietor's contract. This is the way when the price of 1 kilowatt is kind of connected to the um, real situation, and in that way there is no manipulation of the terms of the agreement on the part of the supplier. On the last slide, I will leave my contact data and the contact data of the information where you can find out more on this way of buying the cheapest cheapest electricity. Another item is fuel, and every second buyer is doing it via the request for the price bid. And our enterprise has qualified more than 200 suppliers. These are car filling stations like Vok, Oko, but these also some regional car filling stations. And thanks to that, the customer, no matter where he is located, can buy fuel in Prozorro Market on a competitive basis. And as far as this object of procurement is concerned, the amount of sales exceeds 1,500,000,000 hryvnias in Prozorro Market. Together with the Ministry of Economy, we are now elaborating the following option that has been already set by the CPA when they suggested introducing some of the food items as obligatory for procurement via Prozorro Market. These are the most popular foodstuffs, food items, and already now we can see much better results than during open bidding if done through Prozorro Market. So I hope that in the nearest future the ministry will respond to that suggestion and will introduce the necessary amendments. More than 43% of customers are already buying food via Prozorro Market, and these are not just hospitals or small companies or small departments of education or schools. Even large ones like Ukernafta buy their food via Prozorro Market. Kyiv water treatment and water supply company does it also via Prozorro Market. If we speak about business entities, 96% out of the 100 of most active suppliers of Prozorro have already been qualified and are selling with their goods in Prozorro Market. These are producers of different size and producers in particular of dairy products. Our nearest steps have been already voiced by Nadia Bihun, Deputy Minister of Economy. We are developing construction direction because for post-recovery projects, we would also need to make procurement of different goods, construction goods, very quickly, the way this is now done with medicines and food items. We are actively working on that, and I hope that at the end of this year, we will have a lot of achievements and progress in this respect. Thank you for attention. I didn't feel quite comfortable because Vitaly somehow failed to show my presentation. My presentation looked not the way it was supposed to look. But I hope this has not affected your impressions, and I'm grateful to my colleagues from the State Enterprise Medical Procurement of Ukraine. Thank you. And here is my contact data. I will be happy to answer your questions if any. And in your presentation, you had a lot of text in Italian, right? It's funny. Good. Thank you for improving our mode today. You know, it's more difficult to be a CPA if we have the State Enterprise Central Procurement Agency in Ukraine. So it's difficult for you to keep the same status. But yeah, I can think that if we add air to the goods that are sold on Prozorro Market, then we will compete with you. Okay, let me invite another colleague of ours, Anastasia Skok from the State Enterprise Ukrainian Special Systems. And today, Anastasia will talk about the part she is the administrator of. And I think that we will also have a presentation. Yes. is the assortment expansion button. You've probably seen this button. You just need to fill out the form and to answer some questions and to give those answers to our category managers who will make analysis, who will add this commodity within a certain period of time, and we will give you a message that it has been added. So my colleagues have already spoken about the customers, and I will also speak on them. It's difficult to speak about Vitaly, in particular about Metro. It's difficult to add something new. But everybody knows that what matters about suppliers is experience, is also the certificate from the registry of the National Agency for Corruption Prevention. But now we got to know it about 2 minutes ago that there is already open access to this registry, and there is also the need for the certificate from the Ministry of the Interior. This is not an exhaustive list. Since well, probably I cannot put it that way, but we are kind of breaking the supplier into molecules, into atoms. We are verifying, we are holding due diligence, and this means that our suppliers need to go through a tough verification process, and this, of course, leads to good results. As far as the rules are concerned, well, I would like to draw your attention to the following, and probably I'm repeating this because we have all seen this. You are indicating your technical specifications and your specific requirements to the object of procurement in the notes, but please, it is not allowed. This actually may lead to some questions. And we tend to forget about the National Automation Program, and the procurement processes that fall within this category are to be approved by the Ministry of Digital Transformation. On our website, we've got the algorithm for this approval, step-by-step algorithm. Please use it. And please indicate the terms of payment, the supply delivery schedules. It's good that now we have a draft contract or a template where you need to indicate it, because otherwise it doesn't work well. And let me also tell you about the next steps, about our intentions. Of course, we are actively expanding the range of goods, of standardized goods. These are typical standardized goods that are available in the e-catalog now, and we are also trying to introduce some obligatory categories. Maybe in the future these will be computer equipment, operational systems, but not in the nearest future, some distant future. And the customers can add goods to the catalog on their own. This is done manually. Our category managers may be helpful with that, but that's not optimization of the business process. That's why with our whole team from Prozorro and the National Health Service of Ukraine and our team, we are all working on that. And of course, we should introduce an automatic process, but this is the process involving our facilitation. And we are working on the templates of contracts. And also we are filling in the base of characteristics with further filtering opportunities, narrowing of the profile. So that's what our plan is. Here is my contact data, not only mine, but of my team as well. So please give us calls, write to us. We have not been working for a long period of time in this field, but we are open for communication. Please feel free to make your suggestions, if any. to my presentation, and let me mention that we are doing a lot of things for healthcare institutions, but that is our new audience. And we hold training events, awareness raising events. We introduced some technical amendments. Suppose yesterday we introduced additional amendments that were dictated by the administrator of the system concerning the questions, the opportunity for the participants to ask questions about the bidding announced. We have an agreement with the system administrator on that, but the customers can also affect the vector of the platform's development. And 2 weeks ago, we created an opportunity to make a search based on INN. It didn't seem to be possible, but our clients wanted us to do this, and we managed to do this. We would also ask our partners to join in our awareness raising and training events, and to also get involved in some webinars where we're trying to get a live talk. Though it is all digitalized and the event we're having now is rather an exception, but anyway, people can ask questions if we have this live talk. It's good that the Institute of Cancer, the Hospital for Children have been mentioned today. These are our clients. And Vitaly has managed this Institute of Cancer. And recently we have provided personal training for the representatives of the Institute of Cancer. And it really works, you know, because you have mentioned that they are a successful case. And we need to get them feedback for us to understand where we are okay and where we are not, because sometimes we need to adjust to your needs. So I'm urging all the online speakers to address us with their needs. We are delivering a new course. You will see it, Vitaly, Dmitro, Anastasia there. So just address us and claim that you have the need for training, and I will be happy to provide information on those further trainings to you. In spite of the fact that it was necessary to use the system and to just have a demonstration, and then after it everybody starts using it. No, it doesn't work that way. If you want us to show some demo, we have a meeting with you in Zoom, we show this demo, then we answer your questions, and you can see your video manual there, and you can use it and work with it. And if not, then we have to repeat, and then we continue. And there was another topic, the interface of catalogs. I was supposed to cover it. So, well, thank you. I think that I need to switch to the next slide, to the last slide. So we can see that here is my personal contact and our contacts. So thank you for attention. Thanks a lot. I would also like to mention that we've got quite a number of questions about how we could see the prices in the e-catalog. And probably you can see how in the e-catalog what were the prices for the goods bought by your colleagues from your affiliated partners from other regions. So that is the information that you can see there. I would also like to give the floor I'm sorry again, the sound is very bad. So there has been an invitation for the speech to a person who is representative of another institution, Zakupki Prom. I hope that you can hear me. I'm happy to be with you here Unlike colleagues, I'm going to tell you about some practical things related to the electronic platform because we've got some tricks that I'm going to voice. And I would like to start with figures. In the slides, you can see the customers working on our platform. And I had a look at this figure, at this ratio of customers who were using Prozorro Market while working in Prozorro, and this figure is 24%, but it was not always the case. And this is a rather good result still, since now the customers start using the system more and more because our legislation allows them to do this. And now you can actually buy goods for different amounts of money in Prozorro Market. And there are some categories that where procurement is mandatory via the e-catalog. And in particular, here I'm referring to the customers in the healthcare field. If we speak about tricks, we were actually thinking how to help our customers try out this e-catalog for them to be able to understand how it works and what advantages it contains. Because quite a number of customers somehow do not dare use the e-catalog on their own until they have this legislative requirement in place. So we decided to have the e-catalog simulator, which works as a counterpart to the real catalog. But of course, the customers are not buying real goods there. And for those who want to use this system, the system sets the requirement. Let's say to buy the Harrison watermelon or 15 tons of cotton. So the customer needs to find this commodity in this test catalog and create the request for price bids. And that will help them understand the mechanism of work, and it will help them not to be afraid before they go into the real procurement process and to be more confident when they announce a procurement process. Again, this is the tool that could be used not only by the state customers, but by anyone. And I have watched the analytical data. This tool is rather popular. There are 1,500 users who have tried this tool out over the recent couple of months. So we hope that this simulator is really helpful. And it makes the customers more confident because they have a chance to train, to practice how to do this, how to announce a procurement process in the real time system, and they can avoid some mistakes in this process. If we speak about Prozorro Market, of course, the work of the state procurement agency starts with the search of the commodity. And the goods could be found by category, by the code in the classifier, or by the search word, keyword. What does it look like in practice? If you want to make a search by the category, you first need to choose the general category, then go into detail to a specialized category, and there you've got the profile of the commodity. Now it's called specification, but for customers, well, they tend to call it the profile of the commodity with certain characteristics. Then you can also be looking by the keyword by introducing the keyword into the search line, and the system will show you the goods that have this keyword. And you can also use the code to kind of filter the profiles of different commodities from which you will then create the bids. If we speak about the profile of goods, so far in the catalog, we have two types of them. These are the ones where they can set their characteristics on their own, and there are the profiles where the characteristics have been introduced by the administrators. So what does it look like in practice? Here is the profile with settings, and you as a customer can choose the characteristics that will then be included into the bid. But you can use here a specific brand, and we moved with our colleagues on, and we decided that if the customers want to choose a commodity with certain characteristics, with certain specifications, so why not do it? Why not arrange it in the way that when they are able to use just one button and to do this, to choose a commodity with specific characteristics? Suppose the customer has chosen a certain commodity with certain characteristics. So, well, it's a tube with a certain capacity, and so on and so forth. So the customer can actually press this button that he wants, showing that he wants this specific commodity, and in the profile, he will get all the characteristics that he needs. And the profile with settings can be used only up to a certain amount of money, so it's not valid for all the categories. And here we can see how the profiles with the set characteristics, what they look like. You can see what goods could be offered by the customers in this profile, and you can see other things. If some good is not available, you can just press the button to write, and you can address the administrators, fill out a certain form, and then the administrator of the catalog will consider an opportunity of adding this commodity to the catalog. If we speak about the procurement declaration, that is a very easy, simple process because some information is just transferred from the profile of the commodity with its characteristics to the main information, to the main form. The only thing you need to indicate is the expected price, and a lot of customers are nostalgic about having the prices in the catalog, and that's why we have introduced the tool which could show you the prices generally available in the catalog. So I think that this tool could be used, and you should share this information with your colleagues. Tell them that there is such a tool in Prozorro Market. If we speak about the fields that need to be filled out, we have an opportunity to upload the contract, but there is a restriction. The customer cannot upload more than one file because you can upload only one contract according to the law to avoid any manipulations or any mistakes. And you should not forget that when you are announcing the request for the bid, you can indicate several commodity items, and here is what it looks like. Within one procurement process, if the commodities coincide by the code of the classifier, you could unite them together, join them, and buy them together. As far as disqualification of the participant is concerned, that is a rather new tool, and let me show you what it looks like, because up till recently, up till September, the customer didn't have a chance to disqualify the customers, and there were cases when somebody became the winner, but the customer does not appear at all. There is no communication, there is no contact with them for unknown reasons. So in this case, the customer needed to cancel the request for the bid and to have another declaration of that or announcement of the procedure. But now there is the list that has been approved on the legislative basis. But anyway, this new function enables us to more effectively hold procurement, and you can identify the winner as the winner, the person who was really involved in the procurement process. And the last thing I would like to mention is the feedback. On our platform, we have got the necessary functionality. Maybe it will not affect your decision making or the process of disqualification of the winner or identification of the winner, but at least it will help you as the customers to understand whom you're going to work with and to finally get some information and good characteristics of you as the customer, because the participants normally prefer the customers that have got a good rating, high rating. So if you ask the suppliers with whom you work to leave some feedback and comments on you, and you will give the feedback on them, in return, follow this reciprocality principle, you will get higher competition, better competitive status, and of course, you will save money as a result of that. And if we speak not about the feedback of the participants and customers of each other, but about the feedback on the Prozorro market, I would like to say that the customers that had been working with the catalog for quite a period of time and have got some experience, have made a lot of mistakes, but learned some lessons and got already good results, they still consider that the advantage of this catalog is the speed, the quick operation of this e-catalog and no need to work with paper documents, which always takes a lot of time. So that's all for me. Thank you for attention. Thank you, colleagues, for your interesting tricks that you have shared with us. Here is a comment. You mentioned that it's very difficult to communicate with the administrators, and it occurred to me that today we've been trying to explain what is the functionality of all the stakeholders within our Prozorro Market system. So I hope that you, as our customers and our suppliers, will also understand it, that you have got, that there are a lot of you, and of course, it's not always possible to process all the requests coming to administrator, because everybody thinks that it's about medical healthcare procurement, so the questions are to be addressed to them. It's not possible to process that number of requests. But on the platforms, we have a lot of information, a lot of records on how to work with the e-catalog, how to do this and that thing in the e-catalog. So you are free to use all those information, all those records, to be more effective and to facilitate the process. And I would also like to say that with the support of some other partners, we are also going to hold some joint meetings in order to communicate, in order to discuss different problems, and to communicate and to get some feedback. So I think that this is necessary and that will lead to great outcome and great wishes. Sorry again, the connection is very bad. But please follow the news, because I think that in the nearest future we will have all those meetings. Thanks a lot to our colleagues. Well, in fact, I had a look at the questions. And by the way, if there are questions in the audience, let me ask this. Maybe there are some participants who would like to ask questions offline. Maybe you should ask at least one provocative question. Unfortunately, either the microphone of the presenter doesn't work well or something is wrong with it. The question is about packaging. When packaging does not correspond to the one the customer wants to buy, let's discuss this issue. It's related to your part of work, your field of work. Let me explain what the situation with packaging is. In fact, this is a very popular question among customers, and it's so historically happened that since the beginning of existence of Prozorro Market, within one category of goods, there could be several packaging systems. And the problem of Prozorro is that we don't have any perfect mechanism of identifying the cost of one unit. And therefore, we have some stories when eggs can be calculated in liters or kilometers or something like this. And Prozorro Market is very quick. It performs the function of saving money, but it also trying to perform the function of standardizing the categories of goods. And this is not just our know-how. We have a special unit of measurement that sets the tone for comparing the data, for comparing who buys what. And we do understand that some of the customers are ready to and are used to buy in pallets, in different packaging, depending on the customers. Not everybody wants to do it in liters or in pills, in units. It depends on the administrator, but that is the matter of habit. And you can get some benefits from changing your habits. You can reduce the number of manipulations. You can have better accounting. And it's much easier than to follow the dynamics of prices historically. So I would rather regard this as a competitive advantage, because you will understand immediately how you were buying this or that commodity as compared to other
customers. But if everybody writes the units of measurement on his own, that would not be possible. We had some cases when the potato was calculated in man hours. So how do you compare this? How does it compare? Again, the microphone of the facilitator is bad. So it's something about poor quality goods, how to prevent this. I would split this item into two parts. All the suppliers included into the catalog are qualified, and they are qualified as experts. But what do we do with the ones which have some poor quality goods? But we have got some tricks mentioned in Resolution 822, according to which and you can actually, if there are some claims against the customer, the supplier, then he can just be disqualified. Yes, and as far as the claims are concerned, not to have any inflated expectations, we have the regulation according to which the administrator cannot interfere into the economic activity of business entities. So suppose there are some problems with a supply. Unfortunately, we cannot take on the role of the arbiters, but our colleague from the law firm gave a very good case on the experience of Singapore and Indonesia, I'm sorry. So I think that probably you will also share this information with the colleagues from the Ministry of Economy, because that case and those additional elaborations will be very helpful. Yes, thank you. We don't have any more questions. Suppose you have any further questions, you have got the contact data in the presentation, so you will have a chance to address all of the participants, or you can address the hosts. So thanks a lot to all the participants of our forum. And now you will have some informal communication in a different room. So I'm heartily inviting all of you to this, to the next room for informal communication. And I hope that we will manage to find a lot of answers to the questions, and that we will keep our process going smoothly. Thank you, dear everyone, for your participation.